Another reason is that there are few FDA-approved claims for food and supplements. They only reduce the risk of certain diseases, and they don't treat or cure them. Additionally, the makers of supplements, as mentioned earlier, don't have to show that their products are safe or effective before selling them. In order to minimize risks, it's important to discuss the use of CAM with a doctor. Find out what research says about it, so consider what scientific studies have been done on the safety and effectiveness of any health approach that interests you about CAM. It's also important to identify a complementary health provider, such as an acupuncturist, as carefully as you would choose a conventional health provider. It's also important, before using any of the dietary supplements or herbal products, to make sure to find out about the potential side effects or interactions with medications that an individual could already be taking. In addition to researching about the dietary supplements or herbal products, it's important to look for the word standardized and the USP Dietary Supplement Verified seal, which indicates that the supplement has met certain manufacturing standards, including testing for uniformity, cleanliness, and freedom from environmental contaminants. CAM and global health. CAM, or traditional medicine, has been used for thousands of years with great contributions made by practitioners to human health, particularly as primary health care providers at the community level. Traditional medicine, or CAM, has maintained its popularity worldwide. Some countries even use CAM as part of their primary health care. As mentioned earlier, about 80% of the people in Africa use traditional medicine as their sole form of health care. However, issues continue to arise through the incorrect use of traditional therapies. For instance, the herb ma huang, or ephedra, is traditionally used in China to treat short-term respiratory congestion. In the United States, the herb was marketed as a dietary aid, whose long-term use led to at least a dozen deaths, heart attacks, and strokes. Another example is in Belgium, when at least 70 people were required renal transplants or dialysis for intestinal fibrosis of the kidney after taking the wrong herb from the Aristolochiaceae family, which again was marketed as a dietary aid. To address these issues,